And so diet, exercise, and brain stimulation. And your brain is a very vibrant, healthy organ. You need to exercise it, just like we do our heart, just like we do with our leg muscles, our fine motor skill muscles. You need to exercise.
Hey everyone, welcome back to another episode of the Reshape Your Health podcast. I'm your host, Dr. Morgan Nolte, and I have been wanting to have this person on my podcast for several years now. Her name is Dr. Anna Fisher, and she's a locally and nationally known dementia expert. She has her doctorate in health administration, meaning she has the research and practicality into the workplace. She takes the research and she educates people on how to best care for people with dementia. She is passionate about helping people as we age live the fullest and highest quality of life possible. She serves as a consultant for best practice in dementia care for hospitals and non-hospital organizations. And today's conversation is going to focus on the different types of dementia. A lot of people don't realize that Alzheimer's is not the only form of dementia out there. So we're going to cover those. We're going to talk about some dementia prevention strategies, best practices for dementia care, and of course, caregiver tips to improve communication with your loved one and reduce burnout. So Dr. Anna, thank you so much for coming on the show. I'm excited to talk with you.
Oh, and Morgan, it is my pleasure. Thank you for that wonderful introduction. Excited to be here.
Thank you. Well, let's get started. I always like to ask our guests, how did you get interested in dementia care? Because I know you started your career, you said, as a nurse aide and then maybe a nurse and kind of progressed along the way.
I did, and that's the healthcare side of it. But prior to that is I was in the transportation industry, the railroad industry, and after 25 years, I retired from that industry. And the reason why, Morgan, is had a family member who was diagnosed with a type of dementia. And from there, I completely switched careers and went into healthcare and really started out as a nurse aide and med aide, went on to become a nurse. But I will tell you what that did for me personally was almost boots on the ground in healthcare, really understanding the dynamics at all levels. So it has been a wonderful journey, and it continues to be a journey. And you're going to hear this passion through me, everyone, throughout this conversation today.
I know. So, and actually that is the first time that you've tried to tell me that before, but I didn't realize that you entered healthcare as an adult, like 25 years. So how old were you when you became a nurse?
It was later in life, let's say that, okay? It was later in life. I was a non-traditional student.
Yeah.
So proud, so proud. But, the family member, if they could see me now, would be so proud that I did this. It was just a shifting of priorities. And my message to that is when there's a will, there's a way. If you have a passion, do it to help people. And that was my passion. I saw what I went through. And so I was determined to learn and grow as a result.
That's amazing. So I love your story. Let's kind of start with kind of the big picture overview. And for people who maybe don't know Dr. Anna and how I got to know her, for a while, I worked for a company called Hillcrest Health Services, and they're based out of Bellevue, Nebraska. And Dr. Anna works for them as well. And she does a lot of the general onboarding education for dementia care because Hillcrest works exclusively with older adults, well, primarily with older adults, many of whom have dementia. And so they're really good at caring for people with cognitive impairment. And I've heard Dr. Anna's dementia speech on general onboarding, I think 4 times. And you do such a good job at explaining to people from the CNA level all the way up to doctors of physical therapy, the nuances of the different types of dementia. So I would love to start there with that overview of what is dementia and then what are the different types of dementia?
Certainly. And thank you, Morgan. And so I want to first start out by saying that dementia is a group of symptoms. And I'm very handsy, so I'm going to try
I
to
know, me
explain
too.
it. Think of dementia as an umbrella. Okay, it's a group of symptoms that accompanies any type of change in your brain function, whether it be cognitive, physical decline. Think of each spoke, visualize with me. Think of each spoke under that umbrella is a type of. Here is what's important. There are over 100 types and causes of dementia. This is why we try to educate the communities, the individuals, caregivers. We need to know. The more specific and definitive we can be on the diagnosis, the better we can craft the plan of care to care for that individual. So let's talk about, for the purposes of our conversation, that's some of the top types of dementia. I'm going to start out with Alzheimer's disease. How many have heard of Alzheimer's disease? We all have. I'm making a generalized statement there. Alzheimer's disease is the most common type of dementia. And what you'll see is short-term memory is impacted. In many of these individuals, the memory for long term stays relatively intact, meaning they could tell you the tail number of the plane that they flew in maybe World War II. It's just a stark example, but yet they'll be sitting right there at the table with food in front of them, and they'll say, "When do we eat?" That short-term memory is impacted. And being humans here, we want to gently remind them, your food is right in front of you. Well, that's easy for us in our world, but in their world, they're not recalling that short-term memory. When I first started doing the research, Morgan, the longevity was 5 to 10 years. Now what research is telling us, 2 to 20 years.
Wow.
This can last. So I say this to you, what impact does this have on the caregiver that is watching this from an emotional, psychosocial, and a mental and physical? What are we doing to help the caregiver? And so Alzheimer's disease, what you're going to see on that is the clumps of protein known as that beta amyloid, the clumps, and then you'll see the brain cell wasting. And what happens is that diminished brain capacity for that person to perform at 100% like you and I would. That's Alzheimer's disease. Okay, and let's move on because there's so many that I want to cover. And so it's a progressive decline with the Alzheimer's. With a vascular dementia, what you're going to see is that's a damage to the vessels that supply that blood to the brain. Okay, so the blood vessel challenges or problems, if you will, that can be caused by a stroke. And what makes this one so challenging, we can have a stroke anywhere in our brain, anywhere. So that's why it's so important to know the differences, to know what to look for. Like Alzheimer's disease was that short-term memory. You're going to see with individuals who have a vascular dementia, you might see the slow thinking, but more acutely, meaning sudden change. So are you seeing the differences? Vascular dementia may be more from minutes to hours to days, more of an acute. The challenge therein as we continue this dialogue is a vascular dementia does mirror some of the symptoms similar to Alzheimer's. The bouts of confusion, the rate at which the ability of the brain can process. So again, it's the speed at which the brain processes. Vascular dementia, you're going to see more of an acute type of condition. Then we go into Lewy body. Oh, Morgan, and feel free to stop me anytime if you want me to expand more.
Okay, I will.
Lewy body dementia, obviously named after Dr. Lewy, who had really founded the abnormality of the Lewy bodies. But what you're going to see with the Lewy body is the balloon-like clumps of protein that has been founded in the brain with people of a Lewy body dementia. What happens with this type of dementia, you're going to see more of Parkinsonian type effects. Not to say that that person has Parkinson's disease. There's a difference. Parkinsonian type effects, and I know you can't see me standing to give you these, but it's the unsteady gait, the tremor like, and when they walk, their gait, they may shuffle. They may, and you being a therapist, Morgan, may shuffle. And then when they stop, that freeze factor, we call it, and allow that person to work themselves out of that freeze factor. So a Lewy body dementia may manifest itself with more of a physical component, whereas the others, especially Alzheimer's disease, was more of the cognitive before that physical. I'm going to pause there a moment. Morgan, anything you want me to expand on that before I go into the hallucinations and delusions with Lewy body?
I don't think so. I think that was a good point, that you see the physical before the cognitive a lot of times with the Lewy body. Yep.
Okay, thank you. So everyone, two key things I want you to know. Lewy body individuals have been known, in research and evidence show us, they hallucinate and or they'll have delusions. Okay, they hallucinate people and animals predominantly, but I want to take a moment, if I could, to explain the differences.
Sure,
A hallucination is seeing or hearing things that others cannot. A stark example of this, Morgan, would be someone hallucinating that they're seeing bugs crawling out of the walls in their room. Okay? If it's real to them, it needs to be real to us, meaning we need to enter their world. They're the one with the type of dementia, not us. We need to help them understand. So, for example, if a resident says to me, "Oh, Dr. Anna, there's hundreds of bugs coming out of my walls," I'm going to say to them, "There's bugs." I'm going to acknowledge that. And then I'm going to ask them, "Morgan, what types of bugs?" And they'll usually say to me, "It's big bugs." And the more I talk with them, it calms them. It diffuses any high risk, high anxiety behavior. And then a delusion might be their belief that someone is trying to hurt someone else, or a delusion might be, who are all these children? They're trying to hurt each other. We might see that. So I just wanted to highlight that. So
that was helpful.
That was a Lewy body. And then as we move on, the last main one I want to talk about is frontotemporal. And we've heard a lot more of that in the news when celebrities, famous people get diagnosed. It heightens the awareness and increases the education on this. A frontal lobe is right here. Here's your frontal lobe. This serves as our executive decision making. It serves as the filter of what's appropriate, what's inappropriate. So individuals with frontotemporal, they may not know the difference, Morgan, between right or wrong. They're going to say to you whatever they want. They're going to go into a grocery store and they might say to someone, "You have all that stuff in your cart. You shouldn't be eating it." There's no filter. They're going to say what sometimes you and I may think, but we have that professional filter that withholds us from speaking inappropriately. They're going to blurt it out because the frontal lobe has been significantly impacted. And so you're going to see stark changes in behaviors, their personality. So someone who may have been very mild, well-disciplined, mild-mannered, has frontotemporal dementia. They're going to use every word of profanity known. They can speak, and they may just blurt out things, and you're thinking, where did that come from? So I want to conclude on that one, giving you a stark example that I was recently shared by a caregiver. She took her mom to a funeral. So she pulled her mom out of her residence to take her to a funeral. And they went to the funeral, And the person who had frontotemporal dementia laughed at the funeral. You and I and the rest of the world may think that that's inappropriate, but see, in her world now, she may think that's her new norm. If you're following me on that, that's really a high level summation of the top types of dementia that we are seeing right now.
So,
Please.
Yeah, I think one of the questions is for people who are concerned about dementia, maybe it runs in their family. Maybe they're experiencing, word finding issues, or where did I leave my keys? Or, all of those symptoms that we associate with normal aging. So how do you distinguish like normal age-related cognitive decline versus mild cognitive impairment, or like the start of some form of dementia?
Sure. Great question, too. Well, the best way, obviously, is through cognitive testing and then subsequent diagnostic imaging. But really, what we look at as we age, we are going to have bouts of forgetfulness. The difference is the forgetfulness we will know through memory recall. Like, Morgan, if you were to ask me 10 years ago, did you do this? I'm going to have to dig deep in my memory bank. It might take me a little bit, but I'm going to be able to recall it and recite it to you. Individuals with a type of dementia may not be able to recall any of it in their memory bank and then put it all together. Because keep in mind, as we go through this journey of life, it's a process. It's our ability to draw back on the strength of our memory and put it all together. They may not be able to articulate a complete sentence structure. So they'll leave words 1 through 7 out of it. And Morgan, like, for example, you may go to someone and say, "How are you?" And they'll say, "How fine." In other words, they won't have the recall to say, "I'm fine, Morgan. Wow, I've been doing great with my running." They won't know to put it all together. And then through subsequent cognitive testing, they'll give them a score based on where they are. Does that help?
Yeah, it really does. And are you guys still using or teaching the Allen cognitive levels for testing?
Therapists, they do. Yes.
I thought that was really helpful. Like as a therapist, at least when I was practicing, it was either the occupational therapist or the speech therapist who would do an Allen cognitive test. And then they would get a score. And then based on that score, it gave us really good hints into their insight. And so that changed how we communicated with them. That changed the level of difficulty. That changed how long we expected it to take before we saw progress. And so I think that's really beneficial. Are there other cognitive tests that you would recommend to people who might be concerned about their cognition?
Well, if they go to a doctor, the doctor might give them a mini mental. So out of a score of 30, and there's different questions. So for example, they might ask, say, starting with the number 100, subtract 7, go back 5 places. Then the next question might be, repeat these 3 words after me: apple, table, penny. So what that does is their ability through memory recall, there's no sequential order in those questions. So there are different tests in healthcare. We do a BIMS, which is a brief interview of mental status. So it depends on where you are at the time for the testing. But there is ways to hone in on it. And then obviously a geriatric assessment to get a more defined diagnosis.
Yeah. And I think a big part of dementia and just aging, it's interesting to think about this whole idea of genesis and retrogenesis. Will you just explain that briefly?
Thank you. I was going to thank you getting into that. So Genesis, think of this, everyone, as the evolution of human life. Genesis. We're an infant, we're born, and how blessed we were to be born. Then as you grow, you go into a toddler. You grow into an adolescent. If you are really fortunate, you grow into an adult. Genesis, infant to adult. pretty simple to understand. Now, picture this, if you will, retrogenesis. Retrogenesis. You are on the far end of the spectrum. So here we are as an adult. Here's your 80, 90, 100-year-old. The person who has a type of dementia is reverting back to once was. So as they revert back, now you know why they may no longer be able to dress self, wipe self, brush teeth as they once did, formulate words, ambulate as well as they used to. They're reverting back to once was. So with that said, caregivers will say, this is so depressing. And so I'm here to say, no, it's better to understand. It's frame your mindset. To be really a good caregiver, educate yourself on where they are in the process so you yourself can better understand where they are. Does that help, Morgan? The retro.
Totally. It does. And I do believe that, we have a really good episode on caregiver burnout that I will link in the description. And I think that I wanted to shift this conversation because if somebody has dementia, they're not able to accurately communicate their needs, and this becomes a big problem. So what are some signs that the caregiver should be aware of or should become educated on from things like unmet needs? And how does that, manifest into wandering or, other types of behaviors that we associate with dementia?
Excellent segue into this important discussion, behaviors and understanding behaviors and communication. So do we even know what behaviors means? So let me give you a little definition here.
Yeah, I like that.
It's the way in which one conducts oneself, especially to others. Okay, so we frequently use that in dementia care, that if they're misbehaving or if they're being combative, not cooperating, is that really a behavior? So think of almost an equation. Behavior equals communication. As the brain is digressing with a type of dementia, they're trying to function on what they have left. So their behavior might not be what we think it should be. But please know, it's not about us. We have to learn to remove ourselves and really focus on, to be a good caregiver, what that person is going through. So let's talk about a behavior. Okay. So before I go into all the different examples as you suggested, Morgan, I'm going to throw this out to you and the participants watching this. Do you wake up in the same mood every day? Yes or no? Do you?
No.
No. No. We are different every day. Our brains are going to operate differently. So if I am behaving differently tomorrow, Morgan, than I am today, does that mean I'm acting up? No. It means I'm having a different day. And just because I'm behaving differently doesn't merit the need from a pharmacological intervention to try to get me back to how I was behaving the other day. No, it means that it's a different day. So think about the interruption of brain behavior relationships. And I briefly want to touch upon this. So every day, our sensory information, it may not be able to get to the brain or may not be able to get to it accurately, especially with these individuals with a type of dementia. So that sensorial deficit, and then different parts of the brain, as they digress through the dementia journey, may no longer be able to communicate with each other. I think that's where you have to take a step back. They're the ones with the type of dementia. So the rate at which the brain cell communication, and then what about the processing speed? Think about that, both receptive and expressive. So there's a whole host of things that we need to be considerate of. So here's what I really want to get into. Some of the top needs here. When you see a behavior, are they hungry? Are they thirsty? Is it an unmet need? Are they tired? Because they get easily overstimulated like you and I do. Except we know we have the cognitive ability to go sit in a quiet room and decompress. They won't know how to do that. We have to be able to see that and read it. How about the temperature? Is it too hot? Is it too cold? How about the food? Did it not taste right with them? How about pain? You of all people know pain oftentimes is underdiagnosed, undertreated because they can't tell us. How about from an emotional standpoint? So as a caregiver, if you notice these things, look at what happened before that so-called behavior, look at what's happening during, and then look what's happened post. So pre, during, post. Were they angry? Were they sad? Were they lonely? How about, were they scared? You're coming to give them a pill. Are they knowing at that moment in time, oh my goodness, why are they giving me this pill? What am I supposed to do? Do I swallow it? Or here's another unmet emotional need, everyone. This is a big one. Are they just flat out bored? Have stimulated them? And please know, as a caregiver, focus on the quality, not so much the quantity. If you are able to sit with them, hold their hand over hand is important. That's meeting an emotional need. So let's talk about what you said, wandering.
Wandering. Yeah.
When did that become an unmet need or a behavior? Maybe that person is wandering because they just want to get up and exercise. Maybe they're looking at a pathway of purpose. Maybe you want to guide them. Maybe you want to guide them to an activity. Sit with them, read with them, whether it's spiritual or a magazine. They're looking for a pathway of purpose. And I know there's so many of these that I want to touch upon quickly as well. Sundowning. How many? Morgan, have you heard of sundowning?
Well, yes. And it really reminds me of the baby. So we're talking about retrogenesis, right? A baby cries. They don't tell you, Mom, I'm hungry. Mom, you overfed me. Mom, I'm cold. Mom, I'm hot. Mom, I need to be burped. Mom, I just pooped. Like, Mom, I want a hug. And so when people are going through this retrogenesis, if you can really think about a baby and have the empathy, the same empathy that you have towards a baby, that like, oh, they just can't tell me what they need. That's up to me to really learn their patterns, learn what their behaviors mean, learn all of these things about them. It's almost like you're relearning a person. You knew the person and now you have to relearn the person. So when we're talking about sundowners, I thought of my own kids, because often for kids, it's called the witching hour, where it's like they just won't stop. They won't go to bed. They won't stop crying. So what is it with sundowners for dementia?
Yes, and great. And when we talk about retrogenesis with dignity and respect, we have to always remain focused on they're still an adult, even though they're reverting back, and they still have pride and dignity and respect. So sundowning, please know there's a increased evidence and research on the power of light. So as the sun starts to go down, everyone, without getting too scientific, it impacts our circadian rhythm. Light has an impact on our overall biological clock. So as that sun goes down, you may see increased restlessness, increased agitation, disorientation because of the change of the light. It impacts us the same way. Morgan, say you and I walked into a room that had diminished light. Wouldn't that make you feel a little awkward? Like, gosh, I don't want to fall. So why is it so dark in here? Our hairs almost come up thinking, I don't like it dark. They're
Mm-hmm.
feeling the same way, and we need to anticipate that and be proactive. The other key thing about sundowning is they may have visual and auditory hallucinations because of the shift of the light. And so our recommendation is please try to keep an even flow of light as the day progresses, because think of it, if you shut the light off in the afternoon, it's like throwing another match in the fire. It's already diminished lighting, and then you turning off a light, it's the perfect storm. And
Mm-hmm.
so, really understanding it's like I said, there's no definitive cause of sundowning. But this is research is correlating it back to the behavior and associating it with a decrease in light levels.
So should they maintain it? Like, should they slowly dim the lights in the evening and then only off at bedtime? Or what do you recommend for light?
It depends on the individual, Morgan, because we have people, it's their right. If they want the lights out, you turn the lights out. However, if it's causing maybe undue high level anxiety, we may want to talk to the physician and maybe have an order that states, please leave the lights or light progression. We want to tailor it to the individual. Mm-hmm. That's the best way to do this.
Yeah. And in the notes that you sent to, another common behavior is repetition. So they're repeating the same thing, which is very common. So are there unmet needs that lead to that, or what could be causing that repetition?
So let's think about the unmet need from an auditory standpoint. So as we've dialogued here so far, you can tell we're talking about heightened senses. So that repetitive help me. What day is it? What day is it? What time is it? What time is it? That might not mean that they're asking you the question to ask the question. It might mean they're needing that auditory stimulation.
Oh.
Meaning, have you ever talked to yourself?
Yeah.
I ask all of you, have you ever had self-talk?
Mm-hmm.
Think about it, and we do. But ask yourself, why do you self-talk? You want to maybe hear yourself, repeat it for self-assurance, self-security. They may be feeling the same way. What day is it? And maybe that's attention seeking as well. They may want you to answer them because they've had no idea that they've asked you that 50 times, because each time they ask you, please know it's the first time in their world. Each time is the first time. So, Morgan, if I've asked you the same question 10 times, I want you to have that glorious smile that you're giving me right now. And you're going to respond saying, wow, it's 12 o'clock. Because me being the recipient, we want to feel your energy. And so they could be seeking attention. So some of the other things I just want to touch upon when we say unmet need and you see them having behaviors and senses heightened, is their hearing aid in? I want you to all think about it. That's the nurse in me now.
Yeah.
Is the hearing aid in? And is it in properly? And how about, is it even on? And does it even have a battery that's functional? And do they wear glasses? Eyeglasses? And if so, are the eyeglasses clean? Have you ever worn glasses, anyone? And if you've ever had a smudge, what's that smudge like? Would that just be an irritant? You better believe it will. Okay. Any new adaptive equipment, meaning, did they just come back from a hospital? And did they get an order for a walker, wheelchair, cane? That's going to be new learning. And that might lead to an increase in behaviors because they're having to learn something new. One last thing I want to share is the power of the noise in our environment.
Yeah.
Be mindful of the noise. Our senses are heightened. So when you go to slam a drawer, sometimes we get careless, and especially around the holidays, we're going to take an elbow to a drawer or a
Uh-huh.
hip close a drawer. Do you know what I'm talking
Yep.
about? Get silencers. There's
Mm-hmm.
silencers you can buy to prevent the drawer from slamming, to help with noise reduction. So know that noise it impacts. Every noise has a decibel. So if you are having a radio too loud, or if you yourself are talking too loud, that might impact and have an impact on their behaviors. So I really wanted to touch upon that. And I know we have so much to talk about.
You did such a good job though, covering, I think, the main, the repetition, and the sundowners and the wandering, like, those are all really important things to understand. Okay, why are those happening, so that you can have compassion for your loved one or the person that you're taking care of. And the biggest thing, I know we'll get into more caregiving strategies, but for me, the biggest thing that you taught me was we have to go into their world. And as a student, I was shadowing a physical therapist in long-term care. And I think the physical therapist was somewhere, maybe I was a resident. I was new. I don't know, but I was new. And the resident was saying something like, "Where's my wife? Where's my wife? Where's my wife?" And I went out to the nurse's aide and I was like, "This guy's looking for his wife. Is she here?" I didn't know. It was the first time I'd seen the gentleman, and I hadn't had a lot of experience working with someone who had dementia. And, the aide was like, "No, his wife passed away a long time ago." And so it's like, I felt like I had to go back in that room, and I don't remember what I said, but I didn't say, "Hey, your wife is actually not alive anymore." Because it's like, how do you deal with those kinds of circumstances? Because that is not something that I think people want to be reliving, finding out that their wife passed away. So what do you do? How do you respond in those situations where they're asking you something and you're just like, I don't have the heart to enter into their world right now? So I mean, like, diversion or distraction, or like, what's your best technique there?
And it's redirecting. And a couple of key points you made. It's entering their world. This isn't about us in the moment. So as they revert back, that may be a natural tendency to ask for, "Where's my mom?" And
Mm-hmm.
my response would be to that. So I'll give you a stark example. I have an individual who's in the 90s who will ask me, "Could you check on my mom's schedule for today? She's busy." My response is, "Absolutely. I'm going to check on that." And she is busy. I'm going to meet where she is in her world. And then I'm going to redirect. Let me go check on the schedule and I will return. Here's where family members struggle and caregivers, Morgan. We are humans. We are raised to be transparent and speak truth. And
Mm-hmm.
with the type of dementia, part of this feels like we need to, I try to refrain from using the word falsify.
Mm-hmm.
We feel like we have to fabricate the story,
Yeah.
and we need to enter their world. So as that 90-year-old is reverting back, they may be at 18 years old. They may be asking, "Where's mom at? I just
Mm-hmm.
got home from school. I'm hungry."
Yeah.
Or they may be at that 12-year-old. We have to meet them where they are. Because can you imagine if we said to them, "Well, mom's deceased," and they're at
Right.
a 12-year-old? They're devastated.
Mm-hmm.
This is what's hard for us, is to
Yeah.
take a step back, which leads into this conversation of the environment, the behaviors. And I want to read this from Dr. Maria Montessori, who really founded the Montessori method in dementia care. But this is a powerful quote that I want to share from Dr. Maria Montessori, an Italian physician. "We can say that the amount of challenges and problems manifested by the person is a reaction showing dissatisfaction with an environment that was not made for them.
Mm-hmm.
So I want you all to take a step back, and I want you to ponder the world we live in right now. And for those of us in a coherent state, is this world challenging to live in? It can be. But we do our very best to adjust. We know we have learning mechanisms. For an individual with a type of dementia, it is going to be complex to live in our world. Mm-hmm. That's why you see Morgan having these type of podcasts, to have these education, to help us better understand how to better help that individual cope in a world that really wasn't made for them. And so with that, what does that mean? That we want to tailor activities, recreation, what we can do to sensorial approaches, multisensorial. So to give you an example of an auditory, the power of music. And this is important. We call it music therapy. And I know you're smiling with me.
I know. I loved using music in my therapy sessions.
Yes. That's an auditory stimulation, everyone. Your voice is a powerful instrument. Use it wisely. Live music, and there's more and more evidence that is showing the efficacy of music. And wonderful recorded music is beautiful. Live music, recent research is showing, it's even more effective. So use your voice. I wish I could sing for you all here on that podcast, but I would cause you anxiety. I wish I could sing, but use your voice if you can. If you can hum, like if you're going to give someone a medication, try humming, whether it be "You Are My Sunshine" or the Lord's Prayer. Try that will diffuse a high anxiety person. That's music therapy. Sound therapy. This, Morgan, is what I wanted to share. We call it the elemental powers. I want you to take a step back, if you will. Have you ever noticed wind chimes? Mm-hmm. Or how about the windmills that people have? Are you ever mesmerized by that? Mm-hmm. I know I am. Just listen to my voice right now. When I see or hear a wind chime, especially those that are wood-based, I think that is a most beautiful, soothing sound. Research is showing that's an elemental power here. Think of wind chimes. They maximize the flow of what we call of life force, meaning it requires the wind to make that music. How wonderful is that? It promotes that center, the balance, and it invokes feelings of joy. So that's what I say to you. We have all of these types of music, sound therapy. Use it. It's inexpensive. The other thing as I go along here, the power of smell. That's olfactory, we call it, everyone. Aromatherapy. There's evidence that shows lemon balm, it's claimed to be effective in reducing excitability, restlessness, stress, and insomnia. How about rosemary? That's been known, if you have it in the morning or lavender and orange in the evening, lavender can decrease stress and pain intensity. So this is all evidence-based. The last one I really want to talk about is tactile pet therapy.
Yeah.
If you have a pet, any pet, that tactile stimulation. But if we know all of this to be evidence and research-based, why aren't we doing more of it? And this is where I would love to hear a physician say, I'm going to write a prescription for a dose of music therapy.
Mm-hmm.
The ideal, Morgan.
Yeah. Yeah.
And so those are some of the key things that we look at from a non-pharmacological point. multisensorial, that really maximizes the most of our senses. Can I just describe my little tongs real
Yes,
quick?
of course. Yeah.
As we talk about, everyone, all of these multisensorial approaches, this is a key takeaway. We are so focused on physical skills, cognitive skills. I'm here to help you focus on your fine motor skills. Everybody do this with me. Your pincer grip right here, pincer grip. This, with individuals with a type of dementia, is oftentimes the most to be underutilized. Please, whatever you do, maximize the most of your fine motor skill so we can help them sustain and maximize the most of their activities of daily living. And I told Morgan I was going to share my little tongs.
Mm-hmm.
Everything I use is colorful. Make it colorful and vibrant. But if I see them picking up things, bravo. I want to intensify it. I'm going to say, can you help me pick up that with these tongs? Do you see, everyone, maximizing the pincer grip, hand-eye coordination, plus it makes noise. So everything you do in activity, please make it multisensorial. And Morgan, I could go on all day about this in itself. Anything else you want me to ask about that, or the power of colors? And that might be another podcast.
I was going to say, yeah, let's briefly touch on the power of colors. I think that was something surprising, but also takes me to that retro version again. You know, a lot of child toys are colorful. So what's the power of color in this retro version state?
Yes, so please take advantage of it. Know that blue is a restful color. Blue, restful. It has a calming effect. And in the physical environment, so say you're in your own home, you're in a facility, an environment, wherever you are. What research has showed us is the color of blue in a physical environment has been shown to lower blood pressure. I want you to think about that. The color. All right. So let's go into green. We know the color of green, beautiful color. Listen to the change of my voice tone. Green is associated with life and growth, and it is the most restful of our colors. It reduces our central nervous system activity. Think about that. It reduces our central nervous system, and it helps people feel calm. So like other colors, the color green will actually make a room appear larger. So if you want something that'll be calm, try to interject sprinkles, I call it, or spurts of green. All right. So let's keep going now. Red, one of my most favorite colors. This is what research tells us. Red, it increases your brainwave activity. And it can also stimulate the production of adrenaline into your bloodstream. So what does that adrenaline do? That's the blood flow to your muscles, everyone. So if you're doing an activity, like I have my red tong, use red. If we know this, use a red activity. Okay, what red also does, if you're in an environment, it will decrease the apparent size of a room. It'll maybe make it look smaller. So if you have a person who maybe means to feel safer in a larger room, give them a red blanket. Give them a red sweater so they feel like the room is smaller. The last thing I want to point out about the color red, it can increase the temperature in their mind of the room. So if you again have someone that's cold all the time, maybe interject sprinkles of red so that can, in their mind, think it's increasing the temp. The last color I want to highlight, Morgan, if you will, is yellow. This is important, everyone. It's a highly visible color, and it's often used to carry out important messages. So if you want the recipient to better understand your message, make it yellow background and put large, maybe font on the yellow background to make it pop. Yellow itself will actually make the room look larger. And it's good for if you have that person in a smaller room, say a bathroom, where you want it to have a more restful atmosphere. Let's face it, when you go into the bathroom, it's not the largest of rooms, and the sounds echo in the room, whether it's the water faucet, the streaming, the flushing of the toilet. Maybe you interject sprinkles of yellow on that. So, Morgan, that's what I wanted to say as we conclude on the colors. Do you see how relatively inexpensive that is? And the practicality. If we know this to be true, why aren't we doing it more?
Yes.
And that's what I wanted
Practical.
to say that.
You're so full of these tips. I know that we could go on and on and on with these tips. I did have just one more question for you. You know, when we're talking about caregiver strategies, I think we have to bring up the burnout, and we have to bring up, how can caregivers practice mindfulness and take care of themselves?
That's excellent. And I'm going to touch upon mindfulness here in one moment. So for those of you who are listening and caregivers or know someone who knows someone who knows someone, caregiving is a very challenging, daunting, but yet highly rewarding journey. And I speak to you as a caregiver, walking the talk. I'm still doing it right now with my own family. And I'm retaining my emotions right now while I speak that. I'm going through that journey right now. And so I speak it. And you have to take care of self first and foremost. And I'm a nurse saying it. And do you think I'm taking care of myself all the time? I'm laughing at myself. No, because I'm so busy putting everyone else first. But here's some tips I want to offer you all in when you're interacting with your loved one, a friend that has a type of dementia, is before you enter that room, please do a self-check on your attitude. Please be mindful that they're the ones with the type of dementia, not you. And how blessed that we're not, that we have that sound mind. I want you to really ponder that before you go in. And this is tough, everyone. And before you do go in, just go with me here. Know that they have dignity, pride, and respect they want from you. If you're their child, your adult child, they don't want to see you aching. That's the last thing they want to see. They love you. They adore you. And so when you go in there, greet before you treat or ask. So in other words, we are humans. We are driven by that spirit of inquiry, meaning we're going to walk in the room and say, hey, Mom, hey, Dad, how you doing? Did you eat all of your meal today? Did you engage in activity? You have already bombarded them with questions. They're going to shut down. They have pride. They have dignity. They don't know how to respond to you. They love you. They don't want you to think they're incompetent. So they're going to be quiet. They're going to go like this. And then we're going to think, Mom, what's wrong? Why are you so quiet? They don't know how to tell you that you're the one causing it. So please greet, smile. They are going to mirror your behavior, your attitude. So if you go in there and say, hi, Mom, I'm here to visit, how do you think they're going to react? Versus, hi, Mom, the sun is out today. Boy, the crops are going to really like that. And smile. And if you have to wear a mask, of source control, they can see it through your eyes. Look at them. Look at them. Maintain that. So those are a couple of things that I really wanted to say on when you're further talking with them. Please slow it down. 7 words, 7 seconds. Allow them time to process. You can see the fluctuation or hear it in my voice right now. I want you to enunciate, articulate, because that individual with a type of dementia, they're counting on you to spell the words out for them. So if I'm interacting with, say, a loved one, and their name just happens to be Morgan or whoever, I'm going to say, "Hi, Morgan. It's Nurse Anna. And did you see how I slowed it down? Being mindful, being respectful, be reassuring. And then that's how you engage the individual to provide comfort and build trust." And
Right.
then I'm now going to lead into you, the caregivers. Okay. I want to talk about mindfulness. Does everyone know what mindfulness is? It's really a state of being, and it's a state of being in the moment now. So be with me here as we go through this. Okay. A couple of things I want to point out. Have you ever noticed, just like today and in this podcast, you're paying attention, but are you multitasking at all? Have you ever noticed when you get in a car and you drive, are you thinking about anticipating the next stoplight? Are you thinking about all the things that you have to do? I have to hurry, do this, do that. Or are you being in the moment now and enjoying the peaceful drive? Are you sensitive to every sound that you are encountering? Or again, are you too busy multitasking and thinking about all those things you have to check off of your list? So the benefits of it is slowing down and being more of an observing mode. Okay, not so much of a thinking mode. Your thinking mode is more of analytical. I want you to put that aside for here at another moment. I want you to go with me, and I want you to be in the observing mode. I want you to immerse yourself into this conversation and just focus on the words. And I want you to focus without being judgmental, thinking, "I'm too busy for this. I can't do that. And how long is she wanting me to be non-judgmental?" It's allowing you to be in the moment. Don't judge yourself. Be here, be right now in a flexible, open mind and relish the moment. So how can we better do this? I'm going to give you some mindfulness techniques here. I want you to yawn or just stretch a moment. I want you to take a stretch in the moment, but I want you to do that at least 10 seconds every hour. And you see how Morgan's really getting into it?
Feels so good.
You know why? I want you to know this. Yawning, stretching, that's your body's way of cooling down a warm brain. I want you to think about that. It's resetting. You're doing that, and boy, did that feel good, especially when you're sitting.
Mhm.
Think of your brain. It's so warm. It's observing everything humanly possible. That break in that's cooling off a warm brain. Allow for that reset. That's a takeaway, everyone. I want you to do that with me at least once every hour. Okay? Here's the next thing. I want you to stand up if you can. I want you to breathe. I want you to tune into your body. Notice what you're feeling. Did you go from a sit to a stand rapidly, or did you notice, oh, wow, I was a little bit slower, but I felt every moment of that. It's almost feel that sensation. And then when you stand up, observe your surroundings. Be mindful of that. Then the last exercise I want to share with you really quick, it's a mindfulness exercise. And Morgan and I even do this with our own team members and our caregivers. In our caregiver support groups meetings to help diffuse, because they come in, they're overwhelmed. We're going to say, everybody, we're going to take a moment, go through an exercise. Tell me 5 things you can see, but I want 5 things you haven't noticed before. I want you to tell me. I really want you to observe. And I'm going to tell you what, they're going to have to focus, because usually they'll rattle off, oh, here's the coffee, here's my chair, here's the table. No, I want 5 things you never noticed. Then I go down the 5, 4, 3, 2, 1. What's 4 things you can feel? What can you feel? Is it the comfort of the chair? Are you feeling somebody shaking the table? What's three things you can hear? Are you hearing somebody's phone go off? Are you hearing somebody doing this? Click, 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 click. What are two things you can smell? And these are things, everyone, you haven't noticed before. The number one last thing I'm going to ask you is, what's one thing you can taste? Are you tasting the after effect from taking a sip of that coffee? Think about that. These exercises are there for a reason. This takes you yet a few seconds, but you need to allow yourself to reset. I want to conclude on that part of it, Morgan. Mindfulness, here's what the evidence shows us. It has many positive effects, everyone. It's been known to decrease anxiety, the pain, and how about it decreases sleep-related issues such as insomnia and improves your overall self-awareness. If we know all this and it's evidence-based, why are we not doing more of it? And this is one, Morgan, I will say, I wish a doctor would write more of a dose of mindfulness.
Mm-hmm. Amen to that.
Those are some key things I want to share with you and the participants today.
And I think my last question for you is more of on a personal note. What are you doing to prevent your risk for dementia?
And, thank you, Morgan, because it's in the family. Yeah. And I'm not going to dwell on it and live my life of what might, what if. I'm going to focus on right now. And so diet, exercise, and brain stimulation. And your brain is a very vibrant, healthy organ. You need to exercise it, just like we do our heart, just like we do with our leg muscles, our fine motor skill muscles. You need to exercise. I've shared with Morgan before, running is important to me. And that is an outlet for me to clear my mind, to help me cope with the many challenges of being a caregiver, and to help me reframe my mindset. The other thing too is brain exercises. What does that mean? Well, what is that? Keep your brain stimulated and in a way that you haven't done. So in other words, we become so complacent. We get up every day. We know what to do. We have our habits. We have a routine. Correct?
Correct.
Well, you need to change it up. And here I'm going to give you an example. When I'm in onboarding and everybody always laughs at me, before we start, I might say to them, all right, everyone, dig out a dictionary and I want you to research a word and I want you to use that word in a sentence. And they're like, Dr. Anna, who carries a dictionary? What are you? Well, because we're so complacent on our phone, I'm going to just look it up. But I'm saying to you all, please exercise your brain. And so if you've done something like me as a runner, if I've run the same route, I like flat courses.
Me too.
I'm going to change it up. And so one day I might say, oh gosh, I'm going to go a different way so I can encounter a hill. So, yes, please change it up. Stimulate your mind. Instead of reading 3 pages of a book one day, maybe you go for 5 pages. Instead of maybe knitting, 2 pairs of mittens to donate, maybe you knit 5 pairs. Instead of only dancing or going with your loved one for 5 minutes, try to change it up to keep your brain stimulated. But please, diet, the brain stimulation, and physical. So everything is what makes up our holistic well-being. Thank you.
Yes, and I know that you walk the talk for sure. And thank you so much for all of your tips and your insight today. You're a true dementia expert, and I am so glad that I got to share your wealth of knowledge with our community. I really appreciate your time today. And if people have follow-up questions, can they reach out to you in a certain way?
Absolutely, please. And Morgan, I can send you my contact information, or I don't know how that works. You can reach out to Morgan and I'll share my information with her. But
Yep.
please know I'm here as a resource, help you to navigate through the journey, whatever it might be. And thank you for your attention today.
Thank
Morgan,
you.
what a great opportunity. Thank you.